In this video, find out what can support the treatment of alcoholism, how to neutralize the damaging effects of alcohol on the body, and what to take to return the body to normal functioning. A message from Abram Hoffer, MD, PhD. Ever since I met Bill W., the co-founder of Alcoholics Anonymous, and we became close friends, I have had a personal interest in the treatment of alcoholism. Bill taught that there were three components to the treatment of alcoholism: spiritual, mental, and medical. Alcoholics Anonymous provided a spiritual home for alcoholics that many could not find anywhere else and helped them sustain abstinence. But for many, Alcoholics Anonymous alone was not enough. Not everyone in Alcoholics Anonymous had achieved a comfortable sobriety. Bill recognized that the other two components were important. When he heard of our use of niacin for treating alcoholics, he became very enthusiastic about it because niacin gave these unfortunate patients immense relief from their chronic depression and other physical and mental complaints. Niacin is the most important single treatment for alcoholism, and it is one of the most reliable treatments. And it is safe, much safer than any of the modern psychiatric drugs. Niacin does not work as well when alcoholics are still drinking, but in a few cases it has decreased the intake of alcohol until they were abstinent. This conclusion is based on the work my colleagues and I have done since 1953. I know of many alcoholics who did not want to stop drinking, but did agree to take niacin. Over the years, they gradually were able to reduce their intake until they brought it under control. Some alcoholics can even become social drinkers on a very small scale. I have not found many who could. But I think that if started on the program very early, many more could achieve normalcy. I suspect that treatment centers using those ideas will be made available one day, and will be much more successful than the standard treatment today. This all too often still consists of dumping them into hospitals and letting them dry out, with severe pain and suffering. When they are discharged, most go right back to the alcohol, the most dangerous and widely used street drug available without a prescription. Orthomolecular treatment is the treatment of choice. The following protocol for alcoholism outlines the importance of the nutritional factors that have been shown to be very successful on treating this condition. The treatment can be used alone but is best combined with dietary advice and additional nutrients. The late Dr. Roger Williams, a chemistry professor at the University of Texas and former president of the American Chemical Society, also wrote extensively on the alcoholism. Dr. Williams recommended large doses of vitamins and an amino acid called L-glutamine. What should the alcoholic do to help stop drinking and return his or her body to normal functioning? Supply the following nutrients to the body. Vitamin C to saturation, on the order of 10,000 to 20,000 milligrams per day and more. High doses of vitamin C chemically neutralize the toxic breakdown products of alcohol metabolism. Vitamin C also increases the liver's ability to reverse the fatty buildup so common in alcoholics. To titrate to saturation, take 1,000 milligrams of vitamin C every hour. When saturation is reached, there will be a single episode of diarrhea. Then reduce the dosage to 1,000 milligrams every 4 hours. AB50 complex tablet, comprising 50 milligrams of each of the major B vitamins, 6 times daily. L-glutamine, 2,000 or 3,000 milligrams. L-glutamine is an amino acid that decreases physiological cravings for alcohol. It is one of the two primary energy providers that burn glycogen to provide fuel to the brain and stimulates many neurofunctions. L-glutamine is naturally produced in the liver and kidneys. Alcohol harms the kidneys and liver, thus supplementation is vital, concurrently reducing cravings for sugar and alcohol. Lecithin, 2 to 4 tablespoons daily. Provides inositol and choline, related to the B complex. Lecithin also helps mobilize fats out of the liver. Chromium, at least 200 to perhaps 400 mcg chromium polynicotinate daily. Chromium greatly reduces carbohydrate Ms metabolism, and greatly helps control blood sugar levels. Many, if not most, alcoholics are hypoglycemic. A good high-potency multivitamin, multi-mineral supplement as well, containing magnesium, 400 milligrams, and the antioxidants carotene and D-alpha tocopherol. In summary, the alcoholic's body needs the proper nutrients in adequate quantities to return to normal metabolic functioning. The above nutrients are safe, effective, inexpensive and available from discount stores or health food stores without prescription. Subscribe and like below and check out our next video.